people, and it's gone on far too long.
Good evening. My name is Christine Reynolds. I'm a 62-year-old trans woman from Springfield, Missouri. Since retirement, I've been dropped from 2 part-time jobs and was forced out of a lease on my home when my employers and the leasing agency discovered I am a trans woman. After I began transition, my ex-wife insisted we separate and remove me from her health care plan. I had no choice but to use the ACA marketplace for insurance because I am a type 2 diabetic, requiring certain prescriptions to stay alive. Although my main diabetes prescription had a copay of $10 a month, the medicine skyrocketed to a copay of $440 a month with my new insurance. Because of the high cost, I went without my medication for 3 weeks in February 2019, which left me physically unable to work for 2 months. My blood glucose pegged at 600 several times during this period. After many calls and much frustration, my pharmacist procured an alternative prescription with no copay for 1 year with a coupon from the drug company. It took 3 weeks for my body to tolerate the side effects of the new prescription. I had already lost 63 pounds after my initial diagnosis as diabetic, and I dropped 10 pounds more during this prescription battle, which left me at 163 pounds. At 6'3", I was much too thin, and I felt I was knocking on death's door. However, by mid-March, I was getting stronger, and I returned to a limited work schedule by mid-April. I now work 20 to 25 hours per week, interacting with hundreds of people each day at Target. I'm working during this crisis despite having diabetes, hypertension, and a mitral valve prolapse because I have no choice. I know my health conditions make contracting COVID-19 extremely dangerous for me, but I must work to pay the bills my modest teacher's pension doesn't cover. I've applied for more than 60 jobs in the Springfield area, but no one will hire me when they learn I am transgender. Target is implementing a $2 per hour temporary pay raise, but with our hours being cut and the rising costs of health care, that's not enough to get us through this crisis. In 2020, my monthly health insurance premium was increased from $212 to $302, and copays for my other inscriptions all doubled as well. I retired after 30 years of educating our nation's students, and I'm barely able to make it. Our country has forgotten about people like me, or worse, they know we exist and choose to ignore us. The Poor People's Campaign is filling the void with our voices. It's time for the nation to listen to us. Thank you.
Somebody's hurting our people, and it's gone on